Dans certaines nations, parmi les plus pauvres au monde, il est très difficile d'accéder aux soins de santé. Une prise de décision bien informée peut déterminer si les gens mourront ou vivront. Ces prochaines années, un nouveau projet tentera de révolutionner la manière dont la politique en matière de santé est développée en Afrique. Dans un bidonville de Lusaka, Grace vit avec ses 3 enfants survivants et ses petits-enfants. Il y a quelques années, son fils Masaoso s'est mis à agir bizarrement. On a finalement diagnostiqué que Masaoso souffrait d'une maladie mentale. Mais comme bien des familles zambiennes, Grace a du mal à faire soigner son fils. La Zambie est l'un des pays les plus pauvres au monde, avec une espérance de vie moyenne de 42 ans seulement. Le VIH et le sida, la tuberculose et le paludisme ne sont que quelques-unes des maladies qui font des ravages dans la population et dans le budget limité de la santé.
We tend to concentrate so much on communicable diseases, neglecting non-communicable diseases like mental health.
Moins de 1% du budget de la santé en Zambie est consacré à la santé mentale.
At one stage, we had less than 100 mental health workers across the country, and we only had 1 psychiatrist for a population of about 10 million. You can imagine. So the services deteriorated in terms of quality of service, and most of the health workers were overworked.
I think what we need basically is human resource. We need psychiatrists, we need the clinical psychologists, we need social workers. I think it's critical. You know, once we've got human resource, I think it will be easier for us to provide the services that are required.
Le docteur Mwanza Banda est l'un des 2 seuls psychiatres qui exercent actuellement en Zambie.
We do not give a full comprehensive treatment that is required for patients. We have a shortage of other people who should complement and form the multidisciplinary approach.
De plus, les malades mentaux sont cruellement déconsidérés.
They are discriminated against, they are scorned, they are marginalized, they are ill-treated, they are beaten, they're mentally ill. Sometimes even to take water, rather to go and drink from a tap, no one is going to allow a mentally ill to go on a tap. So you will find that they think he can't drink fresh water.
Steven souffre de schizophrénie et de maladies liées à l'alcool depuis plusieurs années. Il y a 15 jours, on l'a sauvagement agressé dans la rue.
They come beside a man with a jacket and they say, I show you. They're starting beating me.
They look at such people, to be having some kind of social punishment. It's like they are wrongdoers in the community. Therefore, they deserve walking naked. They deserve, eating from rubbish heaps. They just deserve just to be on their own. That's good.
Joseph Kasonde est travailleur social dans le domaine de la santé mentale. Une fois par mois, son ONG fournit à boire et à manger aux malades mentaux de la capitale Lusaka. Sans cette aide, nombreux d'entre eux ne recevraient aucune assistance, ou une assistance très limitée.
the mentally ill themselves, they are able to develop hope in us. They are able to develop trust and confidence to an extent where we try to use that opportunity to persuade them to be referred to a mental health facility for psychiatric assessment.
Voici l'unique hôpital psychiatrique de Zambie, Chinama Hills.
The main problem that we are facing in Chinama today are mental disorders due to drug and alcohol disorders. Then the second one is HIV and AIDS, which is the direct effect of HIV on the brain.
Ndiye kuno ndiye kuchipatala kaili ndiye kumalo yobweresa muntu odwala.
Joyce Langu rend visite à sa fille admise à Chinama il y a 2 semaines.
Chahota ninamuletera ni odwala chifukwa chakuti adwala asokonezeka muntu enzo vula vovala kukhala chintako so na kukamba maningi tinayo paketi naona ati vaina chita siva bwino anambo tenga vintu vakutakhoza oropa ya muntu so oro kumenya mwana.
Joyce ne sait toujours pas de quoi souffre sa fille.
Ntawazina timaganizira kapena vantu amulowa tawazina timaganizira kuti kapena ni maganizo aganiza maningi vija vakuti akakhala na vuto manje simulu kuthandiza bwino ja vuto timu muthandizire kuti akhutire na mutima.
Tout le monde n'a pas accès aux services, si limités soient-ils, proposés à Chinama. En effet, 60% de la population vit hors de Lusaka. Dans la région rurale de Mumbwa, la famille de Florence Kaingo est l'une des nombreuses familles confrontées à la maladie mentale.
There are not so many people who can assist you. They can just look at you like that. And for me, I can't leave my brother, I can't leave my son alone, being in such problem. I have to fight hard so that I can take him to the hospital.
Florence s'occupe de son fils ainsi que de l'un de ses frères.
And I can just say that it's a family disease because there's another brother of mine who also is sick.
There is no services for people with mental health problems at primary health care level. Either they don't have staff or the few staff that are there have been absorbed into general health care. So the tendency is when a patient with mental health problems arrives at health center level, the tendency is to straight away refer them to a general hospital setting when the problem could have been dealt with at primary health care level.
Ces dernières années, le gouvernement zambien a mis en place une politique de santé mentale et des directives à l'intention des personnels soignants communautaires. La législation de 1959, qui régit toujours les malades mentaux, est également en cours de révision. 5 nouveaux psychiatres seront formés l'année prochaine et 120 agents de santé mentale et infirmières spécialisées seront bientôt en poste à travers le pays.
It's a start. The challenge is still huge because our vision as government is to take healthcare as close as possible to the community.
Une partie du problème, c'est que personne ne connaît vraiment l'étendue du problème de santé mentale en Zambie. Cette étude n'a jamais été faite.
Most of the time, we are relying on figures that are not generated from Zambia. We don't have indigenous, generic information or data to support the argument that mental health is an important aspect of the public health agenda for Zambia.
Mais cette situation est en passe de changer. Des chercheurs sont en train de compiler un dossier qui définira la nature et l'étendue du problème de santé mentale de la Zambie.
We believe that the dossier will give us a baseline from where to start from in as far as how we can move in improving services. and then we shall be able to identify what gaps are there in research.
Ce dossier est l'une des premières priorités du projet SURE en Zambie. SURE soutient le recours à des preuves pour la recherche afin de mieux informer les décisions sur les systèmes de santé en Afrique. Le projet collaborera avec les réseaux qui existent actuellement en Afrique et les renforcera.
SURE really can help us implement evidence-based services, because research alone is not an end in itself. It's actually a means also of improving services. We need to, as we implement services, we also need to document what we are doing.
SURE signifie aussi changer la culture qui existe entre les chercheurs et les responsables politiques.
Once we have that understanding, it will be much easier for us to get mental health from lower down to, upper the health service agenda, because researchers on their own can't do it single-handedly. And if policymakers did it on their own, they're going to come up with policy which is not going to be responsive to the needs of the population.
Dans les années à venir, chercheurs et responsables politiques travailleront de concert sur la base de données probantes pour améliorer les soins de santé mentale et le système de santé en Zambie.
If we create that understanding amongst all stakeholders that I have mentioned, I think then we are going to get somewhere with mental health services in the country.
In the next 5 years, we are hoping that we can attain the important vision of improving the quality and the quantity of mental health services in Zambia. And I would like to see comprehensive mental health services provided to all in need. That is my dream.